Plantar fibromatosis. What is plantar fibromatosis? So, you are reading this discussion because you have this lump on the bottom of your foot and you are obviously concerned. Fact is, you may have more than one lump, there may actually be a cluster of lumps. This condition is known as plantar fibromatosis, not to be confused with plantar fasciitis, and in the vast majority of cases these are benign growths that occur on the bottom of the foot. Incidentally, a similar condition occurs on the palms of the hands known as Dupuytren's contracture. Plantar fibromatosis is a disorder of unknown origin. It is basically a herniation of the plantar fascia through its outer covering known as the aponeurosis. Some speculate that it is the result of tiny tears in the plantar fascia, which then undergo rapid repair, and actually over-repair the area. This leads to thickened nodules ranging in size from 0.5 cm to 3.0 cm in diameter. They can then invade the dermis of the skin and sometimes the flexor tendons on the bottom of the foot, making them appear even larger. These nodules may lay dormant for years only to rapidly increase in size in a very short period of time. Plantar fibromatosis tend to occur more in men than women, and in 25% of the cases are seen bilaterally. Typically, patients will present to the office more out of concern about the lump rather than pain, but these growths can be painful. If the nodules are not painful, the treatment of choice is to leave them alone. Sometimes an MRI may be helpful in an effort to show the true extent of the fibroma and whether or not it is pressing on adjacent tissue. Conservative treatment of plantar fibromatosis. If, however, there is pain, conservative management is indicated. Orthopedic padding around the area in the shoe to keep pressure off the plantar fibroma. An orthotic can be very helpful in two ways. One is to keep the plantar fascial ligament from overstretching, which is considered by some to be an aggravating factor, plus the orthotic can be built in a certain manner to keep pressure off the lesion. There are many soft materials which can be used as a top cover on the orthotic to protect the growth. Night splints can be helpful in stretching the plantar fascial ligament and reducing the size of the fibroma. Cortisone injections, which in many cases shrinks them somewhat or at the very least eliminates the pain. But, I will tell you that they can be painful injections. These injections should be spaced out over a 6-week interval, and no more than 3 cortisone injections should be given in a 12-month period, as there are documented cases of tendon ruptures on the bottom of the foot from patients who have had more than 3 injections in an overall 12-month period. These injections will soften the growths, which will reduce pain, but they will not make the fibroma disappear, and there is a relatively high recurrence rate of painful fibromas. Topical Verapamil. There is also available on the market a topical medication that can be applied. The histology behind plantar fibromatosis is hyperfibroblastic activity. Fibroblasts, which are the building blocks of collagen formation, are working in overload in the case of plantar fibromatosis. It has been shown that verapamil, a drug used in hypertension as a calcium channel blocker, can be effective when applied topically to the nodule. Since verapamil inhibits fibroblastic activity, it would make sense that the medication would work better in the early development of these lesions and would be much less effective in chronic episodes of plantar fibromatosis. Read the complete article at www.foot-explained.com/plantar_fibromatose.html